So today we'll be talking about packed cell volume and normal red blood cell indices. Packed cell volume and normal red blood cell indices. Throughout
packed cell,
P-A-C-K-E-D, packed cell volume and normal red blood cell indices. Throughout medical school, you will be given blood results of patients, and you will be asked to identify what is wrong with the blood of that patient. And for you to be able to do that, you need to know what is called packed cell volume, or what we call hematocrit. You need to know what we call mean corpuscular volume, MCV, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration. So you need to know these indices, and you need to also know what we call color index. Now, when you know these indices, the normal value, each of them has a normal value in a normal blood. So when you know the normal value and you are given the blood results of somebody who had just done a complete blood count, when you go to the laboratory, tell them you want to do complete blood counts, they will, do it for you and then give you the results. So if you don't understand these indices we're going to talk about today, you will not be able to diagnose what is wrong with the patient. So that is why this is very important. And sometimes, it depends on the lab that you go to, they might give you the results with your value and then with the normal value, what is supposed to be. But some labs may not give you the normal value, they will only give you your value from your own blood. So you might not know if your blood is normal or something is wrong with your blood if you don't know the normal value. That is why this is important. Okay, so what are the indices we're going to be talking about today for normal red blood cell? We will look at MCV, which I said is called the mean corpuscular volume. MCH, which is mean corpuscular hemoglobin. MCHC, which is mean corpuscular hemoglobin concentration. The last one is not very important, red blood cell distribution width. They hardly talk about that because it doesn't really help so much in diagnosing diseases or abnormalities of red blood cells. Here in this table, we have the normal range of each of these indices. So for the mean corpuscular volume, the normal range is between 81 and 100 femtoliters. 81 to 100 femtoliters is the normal value, and the formula to calculate it is hematocrit times 10 divided by the red blood cell count, which you can see here. But I'm going to show you other slides that explains what each of them really mean. And then we have the mean corpuscular hemoglobin. The formula is hemoglobin times 10 divided by red blood cell count. And the normal range is 26 to 34 picogram. And then we have the mean corpuscular hemoglobin concentration, which is hemoglobin times 100 divided by hematocrit. And the normal value is 31% to 36%. The red blood cell distribution width, a standard deviation of mean corpuscular volume divided by mean corpuscular volume times 100. And it is measured in percentage, which is 11.5 to 14.5%. But like I said, this is not too important, so don't bother about it. But the question we need to ask ourselves is, why do we need to find these values? Why do we need to find? Why do we need to understand the normal range? So again, try to memorize mean corpuscular volume, 81 to 100 femtoliters. Mean corpuscular, yeah, femtoliters. Yeah. Mean corpuscular hemoglobin, 26 to 34 picogram. And mean corpuscular hemoglobin concentration is 31% to 36%. Now, the purpose of understanding these indices is to correlate the fundamental results obtained in CBC, which is your complete blood count. When you go to the lab, they're going to take your blood and give you values of your complete blood count. So, like I said earlier, you need to know the normal value to be able to differentiate or diagnose if something is wrong. And then you also need to know these values because they will help you to classify anemia. In a subsequent lecture, we'll look at anemia and the types of anemia. So when you understand these values, you'll be able to differentiate the types of anemia. Okay, good. Let's start with packed cell volume. Packed cell volume. This is the first thing you need to know. So the packed cell volume is the proportion of blood occupied by red blood cells, expressed in percentage. We said in a previous lecture that blood contains plasma and blood cells. And the blood cells will have the red blood cells, the white blood cells, and the platelets. But the volume or the proportion of blood occupied only by red blood cells, not by white blood cells, not by platelets, not by blood cells in general, only red blood cells, is called packed cell volume. So packed cell volume is defined as the proportion of blood occupied by red blood cells, and we measure it in percentage. It is the volume of red blood cells packed at the bottom of a hematocrit tube when the blood is centrifuged. Now, when we had our first class on blood, I told you that there was an experiment done by William Harvey where he put a sample of blood in a centrifuge machine and spinned it around. And then the blood separated into two layers, the plasma layer and the blood cell layer. Now, but in this experiment, for you to get the packed cell volume, the packed cell volume is the volume of red blood cell that is packed at the bottom of the hematocrit tube when the blood is centrifuged. It is also called hematocrit value or erythrocyte volume fraction. So another name for packed cell volume is hematocrit or erythrocyte volume fraction. And what does this simply mean? It simply means the proportion of blood occupied by only red blood cells. Only red blood cells, not platelets, not leukocytes, only red blood cells. So when I take a sample of blood and I put in a hematocrit tube and I spin it round in that centrifuge, the volume or the amount of blood that goes to settle at the bottom of the tube, the amount of red blood cell that goes to settle at the bottom of the tube is what we call the packed cell volume or hematocrit value or erythrocyte volume fraction. Erythrocyte volume fraction. So why is it important for us to determine the packed cell volume? What is the importance of knowing your packed cell volume? We already said that the packed cell volume is the proportion of red blood cell in the blood, or it is the amount of red blood cell that is packed at the bottom of a hematocrit tube during centrifugation of blood. But why is it important that we know this value? One, it will help us diagnose and treat anemia. Knowing the packed cell volume will help you diagnose and treat anemia. So if a patient comes to you and you realize that the packed cell volume of that patient is decreased or increased, you would know whether the patient has anemia or not. Again, diagnosis and treatment of polycythemia. In the previous class, we talked about what polycythemia is, which is an increase in the amount of red blood cells, right? So if the packed cell volume of the patient increases, that could help you to diagnose if that patient has polycythemia or not. Again, the packed cell volume would also help you determine the extent of dehydration and recovery from dehydration after treatment, because the packed cell volume is affected also by the amount of water in your body. Remember that we said that blood in itself is made up of 91.5% water, right? The whole blood is made up of plasma, is made up of 91.5% water. So it means that when you are dehydrated, something will happen to your plasma volume. It will decrease. And when your plasma volume decreases, it will appear as if your blood cells are increased, because normally we have both plasma and cellular elements. So a decrease in plasma volume, which is caused by a decrease in water when you are dehydrated, will automatically elevate the cellular concentration. So that is why knowing your packed cell volume is important to know the extent of dehydration and recovery from dehydration after treatment, because the amount of water in your body affects the amount of water in your plasma, and that of course will affect the concentration of the cells, especially the red blood cells in the blood. So that is why we need to know the packed cell volume. And then the packed cell volume also helps us to determine blood transfusion, whether a patient needs blood transfusion or not. When somebody has maybe an accident and there is severe bleeding, severe blood loss, it is the hematocrit value, a packed cell volume, that tells us whether this patient needs to be given blood transfusion or not, or if the packed cell volume is good enough for the patient and the patient does not need blood transfusion. So these are the importance of knowing the packed cell volume. One, it will help you to diagnose and treat anemia. Two, it will help you to diagnose and treat polycythemia. Three, it will help you to determine the extent of dehydration. And four, it will help you to decide whether to give blood transfusion to a patient or not. So what is the normal value of the packed cell volume? Now, in males, the normal value is 45% to 45%. So what does that mean? It means that in blood, 40 to 45% of that total blood is red blood cell. And we said that the volume or the proportion of blood that is red blood cells is called the packed cell volume. Good. So it means that in a male, 40 to 45% of the blood is red blood cell, while in a female, 38 to 42% of the blood is red blood cell. So this is a normal packed cell volume. Now, if a patient comes to you and the packed cell volume is less than 40, is 30, for example, so now you know that something is wrong. Why is this patient packed cell volume lower than the normal amount? So that should tell you that there is something wrong with the patient's red blood cell. Maybe there's a decreased amount of red blood cell, or the person had an accident and has lost a lot of blood, red blood cell through bleeding, you know. So that is why this is important. So 40 to 45% in males and 38 to 42% in females. In females. Volume. How do we determine the packed cell volume? So the method to determine the packed cell volume involve the use of an anticoagulant, which is called EDTA, ethylene diamine tetraacetic acid. Ethylene diamine tetraacetic acid is the name of the anticoagulant that is used to determine the packed cell volume. You could also use heparin, okay, heparin. So what you do is that you mix blood with anticoagulants, ETA or heparin, and fill it in a hematocrit tube up to the 100 mark. The tube with the blood is centrifuged, so you spin it round at a speed of 3,000 revolutions per minute. And you do that for 30 minutes. So you are not going to do this as a medical doctor. Only those in the lab, working in the laboratory will do this. But just know that you use an anticoagulant called ETA or heparin, mix it with blood in centrifuge tube, and then spin it around for 30 minutes at a speed of 3,000 revolutions per minute. What will happen? Red blood cells packed at the bottom form the packed cell volume, while the plasma remains above it. In between the red blood cells and the plasma, there is a white buffy coat. What is that white buffy coat? It is your white blood cells and the platelets. So what happens that the blood splits into actually three parts. We have the plasma on top, and then we have the red blood cells at the bottom, they settle at the bottom, while in between we have a tiny layer that is white in color, which is made up of your white blood cells and your platelets. So in the laboratory with modern equipment, hematocrit is not measured directly, but calculated indirectly by what we call an auto-analyzer. It is determined by multiplying red blood cell counts by mean cell volume. However, some amount of plasma is always trapped between the red blood cells. So accurate value is obtained only by direct measurement of PCV. As we said before, the normal values are 40 to 45 and then 38 to 42 in females. Now, what are the variations in packed cell volume? Packed cell volume can increase or decrease. Under what condition would a packed cell volume increase? Packed cell volume will increase under polycythemia, because we said polycythemia is an increase in the number or the amount of red blood cells. So it is only natural for the packed cell volume to increase because polycythemia causes an increase in red blood cell. So whenever there is polycythemia, we have excess red blood cell, and that excess red blood cell will increase the packed cell volume. Okay, so the first instance where packed cell volume increases is under polycythemia. Then in dehydration, like I said earlier, when your body loses water, is lacking water, what will happen is that plasma volume will decrease. And when plasma volume decreases, it increases the concentration of the cellular component of blood. That is why dehydration will cause an increase in packed cell volume. So when somebody comes to the hospital and does a blood test, when you see that there is an increase in packed cell volume, you could either suspect that the patient has polycythemia or the patient has dehydration. Then sometimes the patient might have dengue fever. In dengue fever, there is what we call the shock syndrome. So in that shock syndrome, the packed cell volume also increases. The packed cell volume also increases. So three main things that causes increase in packed cell volume: polycythemia, dehydration, and dengue shock syndrome. Dengue shock syndrome. Three of them will increase the packed cell volume. Good. So what do you need to remember from this slide? How the packed cell volume is determined using ETA or heparin, and then the normal values, and what causes an increase in the packed cell volume. Now, what causes a decrease in packed cell volume? There are four main reasons why packed cell volume will decrease. The first thing is anemia. I said in the previous lecture that anemia simply means a decrease in the amount of red blood cells or hemoglobin. The decrease in red blood cell or hemoglobin is called anemia. And when there is anemia, it is only natural for packed cell volume to decrease, because anemia means decrease in red blood cells. So when red blood cells decrease, packed cell volume will decrease also. Then there is also cirrhosis of the liver. So when there is cirrhosis of the liver is destroyed. You know, the liver tissues are destroyed and they can no longer function properly. And that also leads to a decrease in the packed cell volume. Then during pregnancy, in pregnancy, you know that the pregnant woman shares almost all nutrients in her body with the fetus or the baby in the womb. And so that will now decrease the packed cell volume or the amount of red blood cells or hemoglobin in that woman. Why? Because a pregnant woman is sharing her iron content with the baby in the womb. And when there's a decrease in iron content, it means there will be a decrease in hemoglobin. And when there's a decrease in hemoglobin, that also affects the red blood cell, because the red blood cell contains hemoglobin. And that would also lead to a decrease in packed cell volume. Then the fourth reason why there is a decrease in packed cell volume is hemorrhage due to ectopic pregnancy. So when a woman has ectopic pregnancy, in which the fertilized ovum is implanted or localized in an abnormal position outside of the uterine wall, what happens is that it causes bleeding. And that kind of hemorrhage would lead to a decrease in amount of red blood cells, because the woman is losing blood through bleeding. And when that hemorrhage is severe, it will lead to a decrease in packed cell volume also. So these are the four reasons why, or the four conditions under which packed cell volume decreases: anemia, cirrhosis of liver, pregnancy, and hemorrhage due to ectopic pregnancy. Now, this picture here shows you the packed cell volume, how you determine the packed cell volume. We said that the red blood cell settled down, forming the packed cell volume, okay? And we said it is around 40%. And then here in the middle, we have the white buffy coat made up of the white blood cells and the platelets. And then on top, we have the plasma. So remember, packed cell volume, what causes it to increase, what causes, under what condition does it decrease, and how to determine the packed cell volume using ETA or heparin. Now, what are the other blood indices that we need to study? So the other blood indices that we need to study include mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, and color index. So what is mean corpuscular volume? The mean corpuscular volume is the average volume of a single red blood cell. The average volume of just one red blood cell, not the whole red blood cell together, just one red blood cell. So the mean corpuscular volume is the average volume of a single red blood cell, and it is expressed in cubic microns. So the unit of mean corpuscular volume is cubic microns. The normal mean corpuscular volume is 90 cubic microns, or if you want to take a range, it ranges between 78 cubic microns to 90 cubic microns. So remember this. Normal mean corpuscular volume ranges from 78 to 90 cubic microns. Now, mean corpuscular volume is the average volume of a single red blood cell or a single red corpuscle. Okay. Now, when mean corpuscular volume is normal, pay attention to this. When we have a normal mean corpuscular volume within this range of 78 to 90 cubic microns, the red blood cell is called normocyte. Normocyte because it is normal. When the mean corpuscular volume increases, the cell is known as a macrocyte. Macrocyte, meaning that the cell has increased in size. It is called a macrocyte. So an increase in mean corpuscular volume changes the name of the cell to the red blood cell to a macrocyte, while a decrease in mean corpuscular volume changes the name of the cell to microcyte. In the lecture we had previously, I told you, I talked about macrocytic anemia and megaloblastic anemia, you know, when we talked about vitamin B12 deficiency. We said in vitamin B12 deficiency or folic acid deficiency, we would have macrocyte. The cells will be bigger than normal. So we'll have a macrocyte. So when you have a macrocyte, it means that the mean corpuscular volume has increased. When you have a microcyte, it means that the mean corpuscular volume has decreased. Now, in pernicious anemia and megaloblastic anemia, the red blood cells are macrocytic in nature. So in pernicious anemia and megaloblastic anemia, the red blood cells are macrocytic in nature. But in iron deficiency anemia, the red blood cells are microcytic in nature. So they are smaller. When there is iron deficiency, there is hemoglobin decrease because we said hemoglobin contains iron and globin, heme and globin. So in iron deficiency anemia, there is a lack of hemoglobin production or decreased hemoglobin production, and that means that the red blood cells will be microcytic in nature, and that means that there is mean corpuscular volume decrease. Okay, the decrease in mean corpuscular volume is microcytic, and you find it in iron deficiency anemia, while an increase in mean corpuscular volume is macrocytic, and you find it in pernicious and megaloblastic anemia. Now, the next thing you need to know is mean corpuscular hemoglobin. Mean corpuscular hemoglobin. This time around is hemoglobin, not mean corpuscular volume. So mean corpuscular hemoglobin is the quantity or amount of hemoglobin present in one red blood cell. Mean corpuscular hemoglobin is the quantity or amount of hemoglobin present in one red blood cell. It is expressed in microgram, or what we call picogram. So what is the normal value of the mean corpuscular hemoglobin? It is 30 picogram, or in a range, it is between 27 to 32 picogram. So if a patient comes and has a mean corpuscular hemoglobin of 27, it is normal. If it is 28, it is normal. If it is 29, it is normal. Until it gets to 32, it is still normal. Okay, it is still normal. Now, mean corpuscular hemoglobin is the quantity or amount of hemoglobin present in one red blood cell. So it means that if you have more hemoglobin in one red blood cell, an increase in the hemoglobin content of one red blood cell, then there will be an increase in mean corpuscular hemoglobin. There's a decrease in the hemoglobin content of one red blood cell, then we'll have a decrease in mean corpuscular hemoglobin. Then we also have what is called the mean corpuscular hemoglobin concentration. mean corpuscular hemoglobin concentration. So this is the concentration of hemoglobin in one red blood cell. Here, mean corpuscular hemoglobin is just the quantity or the amount, but mean corpuscular hemoglobin concentration is the concentration of hemoglobin in one red blood cell. It is the amount of hemoglobin expressed in relation to the volume of one red blood cell. So the unit of expression is also in percentage. This is the most important absolute value in the diagnosis of anemia. So when you want to diagnose anemia, the most important indices is the mean corpuscular hemoglobin concentration. And the normal value is 30%, but it ranges between 30% to 38%. So this is the most important one, mean corpuscular hemoglobin concentration, because this one we are trying to compare not just the concentration of the hemoglobin, but we're also comparing it to the amount of the red blood cell. Good. Now, when mean corpuscular hemoglobin is normal, the red blood cell is normochromic. Normochromic. So it will have normal color. When the mean corpuscular hemoglobin decreases, the red blood cell is known as hypochromic. So there'll be a decrease in the color or in the color index of the blood. Now, under what condition do we have normochromic and hypochromic blood? In pernicious anemia and megaloblastic anemia, red blood cells are macrocytic and normochromic, because in those type of anemia, there is no problem with iron. So the iron content is okay. That means the hemoglobin content is okay. But in iron deficiency anemia, red blood cells are microcytic and hypochromic, because the color of that red blood cell is determined by the hemoglobin. We said it's the hemoglobin that gives the blood its color, yeah, its red color. But in iron deficiency, we said there is a decrease in hemoglobin production, and that means it will have hypochromic blood. The color index, the color will be decreased because of the lack of hemoglobin. That is what happens. So a single red blood cell cannot be hyperchromic because the amount of hemoglobin cannot increase beyond normal. So it is the whole blood we're looking at, the concentration of hemoglobin in the red blood cell. Okay, let's see how to calculate. So mean corpuscular hemoglobin is defined as the amount of hemoglobin in average red cell, or the average amount of hemoglobin in all the red cell. It is directly proportional to the amount of hemoglobin and the size of the erythrocyte. What does this mean? Mean corpuscular hemoglobin is directly proportional to the amount of hemoglobin. So it means that when hemoglobin increases, mean corpuscular hemoglobin increases. When hemoglobin decreases, mean corpuscular hemoglobin decreases. That is what it simply means. And the size of the erythrocyte also. So a decrease in the size of erythrocytes would decrease the mean corpuscular hemoglobin. An increase in the size of erythrocytes will mean an increase in mean corpuscular hemoglobin. And the normal range, as we said earlier, is 27 to 32 picogram. 27 to 32 picogram. Calculate the mean corpuscular hemoglobin. It is hemoglobin concentration times 10 divided by red blood cell in million. That is the formula to calculate the mean corpuscular hemoglobin. Now we're going to take an example. So here you see mean corpuscular volume, mean corpuscular volume. We are going to calculate mean corpuscular volume using this formula here. But before we come to this calculation, I want us to talk about color index, because we said that the indices of blood will have mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, and color index. So what is color index? Color index is the ratio between the percentage of hemoglobin and the percentage of red blood cells in the blood. So when you divide the percentage of hemoglobin and the percentage of red blood cell in the blood, that gives you what we call the color index. Actually, it is the average hemoglobin content in one cell of a patient compared to the average hemoglobin content in one cell of a normal person. So that is what we call the color index. And it has a normal value. The normal color index is 1, but it ranges between 0.8 to 1.2. Now, you need to remember this because of examination purposes, and also you're going to be given, as I said before, the blood result of a patient. Once you see the color index, if it's not within this normal range, that will help you to, number one, determine what kind of anemia it is. If it is a hypochromic anemia or it is a normochromic anemia. It will tell you if it is an iron deficiency anemia or if it is a megaloblastic or a pernicious anemia. Now, here it increases in macrocytic or pernicious anemia. So what happens? Color index increases in macrocytic or pernicious anemia. Why? And megaloblastic anemia. So both pernicious anemia and megaloblastic anemia, we say they are macrocytic, meaning there is a bigger size of the red blood cell, and that also increases the color index. While the color index is reduced in iron deficiency anemia, and it is normal in normocytic normochromic anemia. So in iron deficiency anemia, we said we have hypochromic anemia, decreased color index, hypochromic, decreased color, hypochromic anemia. And that is found in iron deficiency anemia because without iron, there is decreased hemoglobin. And when there is decreased hemoglobin, the color index will decrease because color index depend on hemoglobin. Okay, good. So now we need to look at how to calculate the each of the indices. We'll take an example to calculate each of the indices. Now let's look at the mean corpuscular volume. We are going to assume that a patient came to us, that an adult male patient came to us, and we found that the packed cell volume of that patient was 30. We will assume that the patient came to us and the packed cell volume of the patient was 30, and the amount of red blood cell found in the patient was 4 million per cubic millimeter. So now that's an assumption. You know that the normal packed cell volume is not 30. We said in an adult male, the normal packed cell volume is supposed to be between 40 and 45%. But here, we're going to assume that this patient had 30 instead of the normal 40 to 45, right? And then this is an adult male with 4 million red blood cells, but that is not the normal red blood cell in an adult male. It's supposed to be up to 5 million or even 5.6 million red blood cell per microliter of blood from our previous lecture. But in this example, we are just assuming that this patient has 30, the packed cell volume is 30, and the amount of red blood cell is 4 million. So what's the formula for mean corpuscular volume? Formula for mean corpuscular volume, as we said before, is packed cell volume in 1,000 mils times 10 divided by red blood cell count in million. So mean corpuscular volume is packed cell volume divided by red blood cell count times 10. Packed cell volume divided by red blood cell count times 10. So if we do that, we would have 30, if we assume that our patient had 30 packed cell volume, multiply that by 10 and divide that by the amount of red blood cell in the patient, which is 4 million. So what did we get? We got 75 cubic microns. So that's what we got. Now we're going to compare this value, this 75, to the normal mean corpuscular volume to tell us if this is low or if it is higher than the normal amount. Okay, so remember our answer is what, 75. So now we're going to see if this 75. So for all our calculations, we're going to assume that the patient we're using has a red blood cell count of 4 million, hemoglobin content of 8, and a packed cell volume of 30%. All of these are lower than the normal value that we're supposed to get. Now, what is color index? Let's see how to calculate color index. We already said color index from our previous definition is that we are dividing the ratio of hemoglobin in percent by the red blood cell in percent. So color index, to calculate color index, you divide the hemoglobin percentage by the red blood cell count percentage. And we have assumed that our patient has 4 million red blood cells, 8 grams per DL of hemoglobin, and 30% packed cell volume. So if we do that, what are we going to get? Let's calculate the hemoglobin percent first, because to get color index, you must first get hemoglobin percent and then red blood cell percent. Now, hemoglobin percent, how do you get it? It is hemoglobin content in the patient divided by the hemoglobin content in a normal person, multiplied by 100. So to do that, we have assume that our patient has 8 grams per DL of hemoglobin. But in a normal person, the hemoglobin should be 15 grams per DL. Then multiply that by 100, we'll get 53.3%. So our hemoglobin percent is 53.3%.
You have to find hemoglobin.
53, sorry?
So is it how to find hemoglobin in the blood?
No, I didn't get you. Could you repeat that?
And the formula is to find the percentage of hemoglobin in the blood.
Yes, yeah, this is hemoglobin percent. Not the amount of hemoglobin in the blood, just the percentage of hemoglobin. The hemoglobin amount in the blood is different from the percentage of hemoglobin. The hemoglobin amount in the blood is 15 grams per DL. Hemoglobin amount in the blood is 15 grams per DL.
Okay.
But in this patient, the patient has 8 grams per DL. So we need to find the difference in percentage. So what we do, our patient has 8 grams per DL instead of 15 grams per DL. So when we calculate that in percent, it gives us 53.3%. This value, you only need it to calculate color index. It has no more importance, this hemoglobin percent. You only need it to calculate your color index, because to get a color index, you need to find hemoglobin percent. So to find hemoglobin percent, you get the hemoglobin content in the patient, divide by hemoglobin content in a normal person. In a normal person, the normal amount of hemoglobin should be around 15 grams. In an adult male, should be around 15 grams per DL. So we take the patient's own, divide by the normal value that he should have if you were a normal adult, if everything was normal, multiply that by 100, you get 3.3%. Now we need to find the red blood cell percent. To find red blood cell percent, what you do, you take red blood cell count in the patient, divide by red blood cell count in a normal person. The normal red blood cell count in an adult male, we said, is 5 million or 5.6 million. But here we're going to take 5 million as a normal red blood cell in a person that is healthy. But this our patient has 4 million, as we said here. Yeah, we assume 4 million. So what we'll do, it will be 4 million divided by 5 million times 100. So that will give us red blood cell percent. So our patient has red blood cell percent of 80% and hemoglobin percent of 53.3%. So now we can now calculate color index. And we said color index is hemoglobin percent over red blood cell percent. That will give us 53.3% divided by 80%, which will be 0.67%. So in this patient, the color index is 0.67. But what is the normal color index from what we in the previous slide? We said the normal color index is 0.8 to 1.2. Okay, normal color index is 0.8 to 1.2, but this our patient had 0.67%. Why is his color index low? Because his hemoglobin is low. He has 8 hemoglobin instead of 15. And his red blood cell is also low. He has 4 million red blood cell instead of 5 million red blood cell. So that is why the color index is lower than the normal amount. Okay? And when the color index is low, we say the blood is hypochromic. Hypochromic, low color. Why? Because decreased hemoglobin. Hemoglobin gives the blood a color. So when there is decreased hemoglobin, 8 instead of 15, that will definitely affect the color. So that is why we have a low color index in this patient, 0.67 instead of 0.8 or even 1.2. Now, if we take another patient and we assume we take the hemoglobin content, so okay, do this for me now, right? Just for practice. Let's assume that our patient has 6 million red blood cells and the hemoglobin content is 16 grams per DL. So this is 6 million and this is 16 grams per DL. Let's try and find the color index. So what we're going to do, this 8 here will change to 16. No, I said, yeah. So hemoglobin, I said, the patient has 16 grams per DL. So here we'll have 16 in the patient divided by 15, which is the normal amount, times 100. So we'll have 16 over 15 times 100. What would that give us? We should have a calculator.
Okay.
Did you get something? Okay, you don't have a calculator, yeah? So let's assume that our patient has the hemoglobin content.
That is 106.6.
106.6, yes? Okay, good. 106.6. 106.6. Then let's find the red blood cell percent. We said assume that the patient has a red blood cell of 6 million instead of 4 million. So that will give us 6 million over 5 million times 100. What would that be? Sorry?
6 million.
6 million over 5 million times 100. So 6 over 5 times 100. 6/5 times 100.
Uh, 120.
120. So the first one you had 106.6, yes?
Yes, sir.
So we'll now do 106.6 divided by
The answer is
what will you get?
the answer is 0.88.
You get 0.88. If you do 106.6 divide by 100, yeah, it will give you
100. 100. Oh, I thought you said 120. The
Okay.
answer was 120.
It was 120, okay, by
Yes.
120, yeah, so 106.6.
That is 0.88.
0.88, good. So now 0.88, it will be the color index of that patient. Now, if you compare that color index with the normal color index, which is 0.8 to 1.2. So is that patient normal or does it have a decreased color index?
It's normal.
It's normal, yeah. So that patient, the color index would be normal because it falls within the normal range, okay? So that blood will be normochromic, normal color. It will not be hypochromic like this patient that has 0.67, okay? Good. Now, let's look at how to calculate mean corpuscular hemoglobin. So to get mean corpuscular hemoglobin, we said the formula is hemoglobin in gram divided by red blood cell count in million. Or you say hemoglobin in gram divided by red blood cell count in million times 10. So hemoglobin in grams per 100 ml of blood times 10 divided by red blood cell count in million. Now, our patient, we are still using the same value with this patient. Now, what are we going to do? Mean corpuscular hemoglobin will be hemoglobin, which we said is 8, yes? 8, right? Times 10, which will give us 80. And then red blood cell count, we said in this patient is 4 million. That will give us 80/4, which will give us 20 picogram. So it means that the mean corpuscular volume, the mean corpuscular hemoglobin for this patient is 20 picogram. But from what we said, the normal value of mean corpuscular hemoglobin is supposed to be 27 to 32 picogram. So it means that the mean corpuscular hemoglobin of this patient is lower than the normal value. Is that okay?
Sure.
Good. So that should tell you also if this patient is having anemia or the patient is having polycythemia. That should tell you also, because this is decreased, lower than normal. So this patient is having anemia and hypochromic or macrocytic anemia also. Now, mean corpuscular hemoglobin concentration. How do you calculate that? Mean corpuscular hemoglobin concentration, we said it is hemoglobin in gram per 100 ml of blood divided by packed cell volume in 100 ml of blood times 100. So for our patient, hemoglobin, we said is 8. Packed cell volume is 30%. Then multiply that by 100, you will get 26.67, which is the mean corpuscular hemoglobin concentration, 26.67. But the normal should be 30% to 38%. So the mean corpuscular hemoglobin concentration is lower than the normal amount. And I told you that this value is the most important value. Mean corpuscular hemoglobin concentration is the most important value to determine anemia. So from all these values that we saw, the color index is lower than the normal amount. The mean corpuscular volume is lower than the normal amount. The mean corpuscular hemoglobin is lower than the normal. Mean corpuscular hemoglobin concentration is also lower than the normal. So what does that tell us? It shows that this patient is suffering from microcytic hypochromic anemia. And you find this type of anemia in iron deficiency. So when there's iron deficiency anemia, the patient will have microcytic hypochromic anemia. Why? Because in iron deficiency, there will be no hemoglobin, or there will be decreased hemoglobin production, because hemoglobin is formed from iron and globin. And when there's decreased hemoglobin production, color index will decrease, mean corpuscular hemoglobin will decrease, mean corpuscular hemoglobin concentration will decrease. And all of these represents microcytic hypochromic anemia. But we'll still talk about it more. So the summary of red cell indices in common anemia. Type of anemia, mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration. In normocytic normochromic anemia, normocytic normochromic, what does that mean? Normal size of the cell and normal color index, yeah? Normal size, normal color. So in normocytic normochromic anemia, the mean corpuscular volume is normal. The mean corpuscular hemoglobin is normal, and the mean corpuscular hemoglobin concentration is normal also. In microcytic hypochromic anemia, the mean corpuscular volume is decreased, the mean corpuscular hemoglobin is decreased, and the mean corpuscular hemoglobin concentration is decreased. Microcytic hypochromic anemia. Then in macrocytic normochromic anemia, the mean corpuscular volume is increased. So there's an increase in size of the blood cells, macrocytic, but the color index is normal, okay? So that is why we have mean corpuscular volume is increased, mean corpuscular hemoglobin is increased, but the mean corpuscular hemoglobin concentration is normal. That is why it is normochromic, okay? Because the color index will be normal also. So that is everything you need to know about the indices, the red blood cell indices. This is everything you need to know. So remember, we have the packed cell volume, we have the mean corpuscular volume, the mean corpuscular hemoglobin, the mean corpuscular hemoglobin concentration, and the color index. To know them and memorize the normal values. I'm going to look for results of different patients of their complete blood counts from their lab tests. And in the next lecture, we will try to analyze each of the blood results to determine if it is normal or if it is abnormal. If it is normal, if it is abnormal. So if it is normal, you tell me it is normal. If it is abnormal, you tell me whether it is hypochromic, or you tell me whether it is microcytic or macrocytic. You're going to tell me. So that is why you need to memorize these figures. Okay, is there any question?